The agenda this week: assess the party's campaign advertising strategies, consider their healthcare platforms, and asked why some people simply don't get infected with COVID-19. The agenda's week in review begins with opening day of Ontario's 43rd general election.
Very simply, what's this election about?
I think it's a little bit too early to answer that question. As you know, we have about 4 weeks to the election day, and every week in an election in the political realm is a lifetime. And we could be coming back here talking about completely different things next week. So as it stands right now, I think we're looking at the path to prosperity. With the rise of inflation, I think people are mostly looking at pocketbook issues and issues around cost of living, cost of housing, etc.
Okay, Kim Wright, in your view, what's this election about?
To me, it really is about where you want to take this province. And one of the things that we saw during the pandemic so clearly is what is the role of government? What are the institutions that Ontarians really do count on, not in some sort of theoretical, poli-sci class, but when we start to talk about how we build a community, how do we make sure that our long-term care facilities are actually taking care of our loved ones? How do we make sure our public health institutions are not only talking to one another, but are demonstrably keeping people safe? Those are all part of the role of government. So what you have to have is a government that is interested in fixing the problems, not just talking about them. But how do you actually move forward? How do you connect with people? And that's what you're going to see over the course of the next 28 days through all of the campaigns. But certainly that's the focus of Andrea Horwath and the New Democrats.
Tim Murphy, what's this election about?
Well, I think it's ultimately a referendum on the government and whether, frankly, you think the healthcare system is better than it was four years ago, whether you think the education system is better than it was 4 years ago, whether the issues of affordability, of the costs of groceries, of housing, of just living every day is more easy to afford than it was 4 years ago, and whether those things were handled well over the course of the last 4 years. And then once you kind of come to the answer to that question, the question is who's best positioned to then, assuming you're deciding to change, can best fix some of those problems. And Steve Del Duca is the answer to that question. That's
the first time I've ever heard him called Steve Del Duca. Are you breaking news here today, Tim?
Yeah. I break news whenever I've just known him for so long. I apologize. I know it's the official frame. But just so we're clear, Steve, we only have people who look like Steve comment on television as well.
Follicularly challenged, I think, is the way you want to put that. Okay, I get you. Sean Yeo, come on in here and tell us what this election's about.
I think the people of Ontario have a very important and legitimate question to ask: how are we going to be taken care of over the next 4 years, and how can we take care of each other? And I certainly agree that a huge part of that is looking at the record of each party and asking how well did they do in the last 4 years.
Sabrina, your view.
Well, I think certainly what the electorate are telling pollsters is that it's affordability, and what we're hearing from the parties, it's kind of like, what exactly does affordability mean to you? That can be everything from being able to afford a down payment on your first home to, as the Liberals have proposed, getting a break on your grocery bill, with scrapping the HST from prepared foods up to $20. So I think it's cost of living is if I had to pick one issue, I would go with that one.
Sabrina, I am not going to ask you whether you think the government deserves to be reelected or anything like that, because that's probably not fair to put you in that position. But let me twist the question a bit this way for you. The most significant commitment that Doug Ford made 4 years ago while campaigning for office that he kept, what do you think it is?
Well, I think it kind of depends on your vantage point on this front, because certainly a lot of these, promise made, promise kept, that line that we keep hearing from the conservatives can be spun a little bit. For instance, I'm thinking of this gas tax cut that was a little late in coming. It's temporary. We need to give the Ford government a second mandate in order to see, 5.7 cents shaved off for 6 months only. There's, a tax cut for folks earning up to $50,000 when we know, 4 years ago, they promised a 20% income tax cut for middle income earners. And I would say that it sort of depends on your spin of that.
The Conservatives have made clear that what they're going to do is cheerlead their folks right to the polls. Their ads are very much like something right out of a Nickelback video. There's the fist pumping, anthemic music. They might as well have called it "Get Her Done" instead of "Get It Done." It's a very folksy approach to things. The NDP, they have had a few kicks at this with their current leader. And so their first order of business appears to be taking on the record of the government, attacking Stephen Del Duca, trying to establish their own leader as the credible choice. You have no other alternatives. Let's go with the credible one this time. I think that's very much what they're trying to go for. And interestingly, I was surprised when they did test some ads out last fall, and it'll be interesting to see if they reprise this theme during the campaign. It was interesting that they recycled a phrase from the 2011 federal conservative campaign, pasting Doug Ford and Stephen Del Duca with this "he didn't come back for you" business that was used against Michael Ignatieff by the Conservatives. It'll be interesting to see if the NDP continues that theme about, they're not here for you, they're here for power, they're here for other things. In terms of the Liberals, there's no question they're going to be attacking the Ford government's record, but they're also going to be introducing people to Stephen Del Duca, and that's very clear from the very first ad they dropped. They are concerned, and they should be, that people don't know who Stephen Del Duca is, what he stands for, which makes him a bit of a blank slate for the other parties to write their story on. And so they're working really hard early to try and create a narrative about Stephen Del Duca that they think will be appealing and positive. And as for the Greens, the Green Party obviously has a big hill to climb, but they're very much pushing the credibility buttons. They're talking about, in their bits, in their 30-second pieces, they're talking about having a real plan for, a real plan for housing, a real plan for mental health, a real plan for climate change. So they're trying to push, again, that credibility button and show that they're about business, they're not about pomp and circumstance.
Laura, I'll get your take as well on that. Was there anything that stood out, whether from Tim's response there as well, but from the major parties as well?
The one thing I'm really noticing is the way the Conservatives are kind of going after the previous Liberal governments. And I think that's an interesting one to consider. I mean, the Liberals aren't the opposition right now, right? They are definitely, I'd say, weaker electorally than the NDP, although they're fighting hard against that. And the PCs are going back in time saying, remember, you didn't like that before, and we've cleaned up that mess. And so I think that's an interesting bit of positioning. It says a little bit about what the PCs think is their real opposition this time around. I mean, I think, obviously Tim gave a great rundown of the different campaigns, so I don't need to reiterate those. But what I'm really kind of watching is the way that the NDP is trying to position itself as like, here's the alternative to what you have, right? And then the Liberals are really hard trying to, I guess, come back up. So certainly, yes, introducing their leader, that's definitely a big thing. But it's hard sometimes to differentiate between the Liberals and the NDP in a lot of the things that they promise and a lot of the things that they say. And so, it's the starker contrast, I think, that comes between the PCs and the NDP, and that's what they're trying to kind of go forward on, right? Like, if not that, then us, and we're the ones who've been here. So it'll be interesting to watch whether these messages change and whether the PCs actually, turn and start to target the NDP a little bit more.
As much as we're talking about the message, I think a big part about advertising is the dollars as well. And Tim, when we talk about the advertisement dollars and getting the message out there, which party typically has the deeper pockets?
Well, typically the incumbent party does, and that's certainly true this time. The Conservatives have been fundraising like gangbusters even through the pandemic. But interestingly, this time the NDP has the biggest budget it's ever had. It has more money at the moment than the Liberals currently do. So it will put them in a really interesting position in this campaign to be able to spend a lot more than they're used to being able to spend on an ad buy.
Now, Laura, when it's election time, there's lots of rules. And that's the same thing when it comes to advertising as well. How do political advertising rules dictate what parties can and can't do, and sort of a timeline as well? Because these rules sort of date back well into 2021 or the later half of the year as well.
Well, the biggest thing is what happens now, right? Basically today, with the start of the campaign, that's when the real rules come into play.
Let me just, because you all have a different lens upon which you see the healthcare system, get you from your vantage point to tell us off the top here what you think the biggest problem the pandemic has caused in our healthcare system from your vantage point. Dr. Zacharias, why don't you go first?
Absolutely. And thank you for the congratulations, Steve. It's an honor, actually, to represent Ontario's 43,000 physicians. And indeed, I start my term today. But the backlog and the backlog, really, the pandemic has exposed 21 million patient care procedures that have been waylaid during the crisis of COVID. And we recently had an opportunity to poll all of Ontarians, and they said this is the #1 priority. It's exposed that we're behind and also that we're exhausted. Teams of healthcare providers are indeed exhausted. It's been stressful, the pandemic, and that's really where we're at.
Dr. Danielle Martin, we had you on this program not too long ago talking about that very thing, but given a new opportunity to speak about this, what would you say is the biggest problem right now today?
My biggest concern right now, Steve, is the number of people who've become disconnected or loosely connected to their family doctor or primary care team, because we can't get people back in for the canceled procedures or the ultrasound or back up to date on their screening or back on track with their diabetes care or any of the things that have been pushed off and fallen through the cracks in the pandemic if people aren't closely connected to primary care. So I think that is the most important task ahead of us.
All right, Dr. Banerjee, what say you?
I'd say it's a lack of trust between physicians, nurses, and other front care providers, health care providers, with the government. And the government has really basically ignored the advice of physicians, infectious disease specialists, public health specialists. And for example, throughout the pandemic, they refused to have sick days for people that were sick and people we knew had COVID, and they had to go back to work because they had no choice. And recently, for example, despite a lot of us saying that it's not safe, they removed the mask mandate for children, young children in schools where most of them are unvaccinated. So that's part of it. I think there's a huge mental health crisis right now, and there's not a lot of resources and lot of wait times. The other thing is that the Ontario government has ignored First Nations, and they've been left to fight COVID basically on their own. You know, when Ford said, you know, we need masks in every school, get HEPA filters, not one First Nation school got HEPA filters and the masks. And so recently when First Nations communities in the north were on fire, and that's not too long ago, it's just in the past month, we've been coming down from COVID, they cut the funding to the nomadic health units through Orange, where, you know, these units were supposed to go in and give support to the communities. So I think there's been, all of this points to the lack of trust.
All right, lots to follow up there, which we shall do over the course of our discussion. Catherine Hoy, how about from your vantage point?
I'd first like to thank you very much for the invite. It's such an honor. But listening to the other three speakers, it all comes down to, though, we cannot provide service because of the staffing crisis. The pandemic has led to a staffing crisis that we have never seen before. And the Ontario Nurses Association has been telling the government this for years. I would estimate we're at 30,000 nurses short, plus healthcare professionals. And I would have thought that the government would have listened to the SARS report where it said your most important resources are your staffing. And they did not listen to that. Instead, staffing is the largest line item on a budget. So that is where they wanted to save the dollars. So we cannot provide the surgeries. We cannot help the family physicians. We cannot help schools. Everywhere that healthcare touches, because we do not have the staff. And the people of Ontario, they really need to listen. They really need to look at the platforms this election, because healthcare is number one.
Are there any other certain demographic groups that are more likely to be, quote unquote, COVID resistant?
So that's a great question. And just to go back to the fact that I think we have a lot to learn from our different cohorts, as Dawn just mentioned, particularly the elderly. And what we've come to realize, at least for COVID, is if we remember back to the first waves, the demographic cohort that was essentially slaughtered with the first waves in COVID were the elderly, and particularly the elderly male. At the time, our understanding was essentially rudimentary, if not speculative, that maybe they had an old immune system or something to that effect. But we and others have collaborated to identify that, in fact, the elderly, but particularly elderly male, have what we call autoantibodies that actually neutralize their response to a molecule of the immune system called type 1 interferon. And as a result, that is at least a one contributing factor to why they get life-threatening disease. On the other hand, what you're asking is, why are there some other people who are resistant? And in fact, we have an even rarer cohort of people who have actually suffered and survived through two pandemics, both the pandemic flu of 1918 and, of course, the current pandemic. So that puts them at a very, rare cohort of 104 or so and older. So we're trying to understand the molecular and perhaps the genetic reasons for why some of these people tend to be what we call resistant or resilient, if you will. But we're still early in that process.
Okay, let's talk about research. Donald and Dawn, you both are working on and leading some research. And I want to start with Donald. You're part of an international study looking into why people exposed to COVID haven't gotten sick. How would you describe this project and sort of the goals there and where you're at right now?
Well, so this consortium is called the COVID Human Genetics Effort. It's led by doctors Jean-Laurent Casanova out of the Rockefeller and Helen Sue at the NIH, and we're the Canadian, major site that's collaborating with this group. In this group, we've actually identified that for the severe cases, we've identified the autoantibodies that I just mentioned, and in a small cohort of people, also they have genetic mutations that impair their ability to fight off the virus, and then that's why they get the severe disease. And so now we're trying to understand the resistance component, as we were talking about with our other guests just a few minutes ago. And so what we're trying to do there is recruit, and we're actually recruiting from long-term care facilities across the country, also community dwelling people who tell us, we have proof that we were exposed to people who were infected. Many of them are actually not properly vaccinated or at all vaccinated, and so we're contributing to that. And we have in this collaboration, we have about 1,000 people or so that have gone through the various steps that we've defined to make sure that they really are, have never been infected. They really are what we call COVID naive. And now we're in the process of analyzing the genomic data.
I want to pick COVID naive. Is that what you said?
Yeah, that's the term that we use, and we don't mean that in any sort of derogatory term. We just mean that their immune system has not effectively seen the virus through immunological tests that we run on their blood samples.
And what exact tests are those? And those would be very different from the tests that the public would have seen so far, correct?
Yeah, so first of all, we're physicians, right? So as physicians, we speak to the patients and we get a history from them. When we find out, okay, well, tell us about the person in your entourage, your loved one or your family member who was infected. How sick were they? How exposed were you to them? So we get all that kind of what we call clinical information. And then we also go for what we call their microbiological information. We ask them to provide us the results of their tests, either PCR tests or rapid antigen tests that demonstrate that, in fact, they were tested and consistently negative. And then after that, we take their blood and we look for antibodies that either are related to the virus or to the vaccine or both or to neither. And we also look at their cells and look to see if their cells can recognize COVID. And if, of course, they can't recognize COVID, that would also help us support the idea that their body really has not been infected with COVID before.
All right, Dawn, long-term care homes have been the epicenter of the pandemic across this country. You're doing something similar in terms of looking at the research there. What are you looking for exactly?
One of the things we're investigating is the relative role of the different arms of the immune system. We've all heard about antibodies, especially in the context of vaccination, and in general, having high levels of antibody tend to be more protective than having low levels of antibodies. But there's a second arm of the immune system, and that's the cellular arm of the immune system. And what's fascinating about the aging immune system is it comes with decades of immune experience. We actually have circulating relatives of SARS-CoV-2 called the seasonal coronaviruses. And the infection rates for those viruses are very, very high in long-term care. So one of our hypotheses, based on studies that have been done in other parts of the world, is that some of these people who are resistant may be using that cellular arm of the immune response and may be drawing upon some of that immune memory of those related viruses to help deal with an infection when they see the SARS-CoV-2. And so I think as we're sort of refining, and my colleague, Dr. Miller, I'm sure will expand on this, but as we're refining our understanding of what can protect us, we realize that capturing those cellular immune responses may be incredibly important in dealing with variants of concern and with future variants, because there does seem to be a little bit more familiarity between the different types of virus that allows people to pull up those immune responses and deal with those future infections.
That's just some of what we covered this week. You can find the full conversations on our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.